Thank you. Moving to Mr. Garrick.
Thank you, Mr. Chairman. I, too, Dr. Pan, have a high regard for you, and I know that you're bringing this forward with all good intent and knowing your Hippocratic Oath, that being including the statement not to harm. A lot of individuals express some concern about potential negative impacts. I believe the immunization programs that have existed in America were well intended and have had a lot of positive impacts. As reading through the bill, I understand it actually requires a written statement signed by a healthcare practitioner, and I thank my colleague for clarifying the healthcare practitioner. That seems to be, although numerous in our large state of 38 plus million people, 130,000, is still not one on every block, but a care practitioner that indicates that the healthcare practitioner provided the parent or guardian of the person with information regarding the benefits and risks of the immunization and the health risks of the communicable diseases. Is that the intent of the bill?
Yes, that is.
My understanding is that there already exists a California school immunization card, and that's State Form PM 286, produced by the State of California Department of Health Services Immunization Branch. And on the back there is a personal belief affidavit to be signed by parent or guardian, and it requires that they sign that there is a personal objection to any immunization. Is that correct?
That is correct.
This bill would seem to be redundant as it relates to the necessity of a parent or guardian, as I believe your bill addresses, sign off on their personal beliefs or hesitations, reservations, as they may be, for medical care. And wouldn't your good intentions, as far as additional information, more appropriately be associated with the sign-off at this level and could be administered by a school administrator in the form of information printed and handed to them and discussed with them, be it a school nurse or anything, instead of just 130,000 out of 38.5 million people in the state of California?
So what I would say is that, first of all, I'm very familiar with that form. There's actually no requirement when some currently, and that's what the change in the law is that when someone signs that personal belief exemption statement, that they've had an opportunity to talk to a licensed healthcare professional about that decision. So just because you have a form and someone signed off on those two sentences, I believe there's two in the back, that does not mean that you've had that education. Again, for the reason that I'm running this bill is because that decision doesn't just impact that family's child. It impacts, because they're entering school, it impacts the other children in the school, it impacts the larger community. And so, there's no so we can certainly build in, part of the bill has the Department of Public Health craft some language. It could be put onto into that particular form, or it could be a separate letter. We want to make sure that it's actually as easy as possible. We want for that to occur for the parents. We're not trying to throw up barriers in that regard. And so what we do want to do is be sure, because that small percentage that Dr. Blumberg talked about, that can make a difference between whether when a child catches a vaccine-preventable illness overseas somewhere and they come into the community and they go back to school from their vacation or wherever they got, whether that disease is going to stop right there with that child because other children around, they're all vaccinated and protected, or is that going to start breaking out and spreading out through the community? And that's what the concern is that we want to be sure that people understand that's part of the risk that they're taking when we make the decision.
May I?
Yes.
May I just add?
May I conclude?
Please, Mr. Garrick.
Okay.
Unless you would like to let any other individuals respond.
Well,
I know it's going on, but I do wish to.
You have a response to Mr. Garrick's question?
I'm sorry, I just have a brief clarification with that, which is that providing we don't believe that there's a one-size-fits-all solution to this. There's a lot of varying concerns that parents have, which we've heard today. And so we believe that more of an individual one-on-one counseling session is more appropriate from somebody who routinely administers vaccines. Some school nurses may not routinely administer vaccines, so I'm not sure that they would have the same knowledge base that the child's health care provider would have.
Thank you for your input. I can see your point that on some occasions one-on-one would be of value, but this form from the state of California does identify the scenario that you have outlined that says, I understand that in the case of an outbreak of any one of these diseases, the child may be temporarily excluded from attending his or her class. So it covers that. And again, I would be more than willing to work with you that this information that you're concerned about and a consultation period be more than just 2 sentences, be added to this, but a whole bill that would be somewhat redundant, not somewhat, it seems directly redundant to what exists here in the already existing California school immunization record that applies to all public and private schools, seems unnecessary at this time, and would be pleased to work with you in the future on adding additional educational aspects to the existing process. Thank you.
I'm always happy to work with you,
Mr.
Assemblymember
Chairman.
Garrick.
Thank you, Mr. Garrick. Now, seeing no further members with, I'm sorry, Mr. Nastandi.
Thank you, Mr. Chair. And, when I first heard of the bill, I was inclined to support it, but coming here with an open mind, I'm moving more to opposing it, and I'd like to hear, actually, first to the opposition, if I might. Do you dismiss the potential problem of spread of disease?
I'd like to just tell you all that I did provide plenty of information, journal articles, examples of outbreaks of measles and pertussis in fully vaccinated populations. I cannot address everything that I would need to answer you in this amount of time.
You don't believe that immunizations play a positive role in our health?
I believe you need to look at each disease and look at the history of each, and I can't go over that in the time that I have right now. So I really can't answer your question. Go ahead.
Well, I can speak as a pediatrician. I do agree that vaccines play a tremendous role in limiting diseases in our country. I am fully in agreement with that. Everyone raises the issue of whooping cough or pertussis outbreaks, and the data are very clear that the number one reason for pertussis outbreaks in California and nationwide are because the vaccine wears off. The vaccine doesn't last long enough. And I provided the Assembly members with a study, and I have it right here, declaring the pertussis vaccine is only 41% effective in some age groups.
Let me stop you there from it. So you would want to have double the vaccines in, or what would be your solution?
I think my solution, the solution that public health officials are looking at is additional pertussis vaccination. But I think the point from that information is that these outbreaks are not because of unvaccinated children. They're because some vaccines don't work as well as we wish they would.
I just don't know if that argues to your point of not vaccinating. But
Well, I'm not against vaccinations at all. I'm just thinking for a free
I would
choice.
say that argues to the point that diseases spread without proper vaccination or without enough of vaccination. It sounds like that's the point you were making.
No, it's not. And my point is that diseases don't just spread because of unvaccinated children. They spread because vaccines don't always work very well.
Or they lapse. And so
Or they
therefore
lapse.
so you'd say
Yes.
vaccine once and vaccine again in 5 years or something like that.
Right, and we can't blame unvaccinated children all the time on this problem.
With all due respect, you haven't had all the vaccines kids get today, so you yourself are a threat to the herd right now.
Well, I think in going to the point, actually, that Mr. Garrick made, and Dr. Pan, I'd like to hear your response to that.
Sure.
That the bill does seem somewhat redundant, because going back to what you said earlier, that as and I have kids, as you go into the doctor's office when the woman is pregnant, gave birth, go to have a visit at the doctor, numerous chances, and there will be numerous times to talk about vaccination. And presumably they are, as he said, they're talked about quite a bit. So I would think I don't quite get the point of having this proactive sign-off when you can certainly tell every doctor in medical school to have this discussion about vaccination. Make sure your patient clearly understand the necessity, if you want to say, of vaccination. So I don't quite know why you would want to go that extra step to mandate a sign-off. Please respond.
Yes. So first of all, certainly in case of parents where they have had a regular contact with a particular healthcare professional, could be a physician, nurse practitioner, physician assistant, now, they're going to get the ongoing, it's going to be fairly simple, take care of the form if they've decided that they've chosen not to have their child vaccinated. The issue is that there is a percentage of people who don't necessarily get consistent care or where there may be discontinuities. And then what happens is that now they're entering school and they're missing some vaccines. They may not be missing all of them. They may be missing some. And then it comes very much to the issue that you pointed out that that Dr. Sears has brought up. The thing is that the percentage of there's going to be a certain percentage of people who the vaccine don't take. There's going to be a certain percentage of people and you're going to have people who haven't been vaccinated. And as that percentage grows and grows, that makes it more likely for there to be outbreaks in the community. Now, again, we want to, for many parents. First of all, many parents who get their kids vaccinated, they don't need to get they've actually gone through the process and internally at the form sign. What they have to do is get all the dates and submit it to the school. For the ones who decided not to, it's actually what we want to do is we're going to work to be sure we facilitate them being able to get, if that's what their choice is, to be able to get the form signed. But we want to be sure that people had the opportunity to get the counseling that they need about vaccinations. So there's going to be a small percentage of people who don't. There's going to be a large percentage of people who do.
I think that's kind of my point. I appreciate your answer, and I guess you can make a valid argument that through a loophole in that system, that might happen. I guess my question back to you is it worth the angst that people truly have, it sounds like, with this seems to be draconian action to go against their personal belief and will to do that? That's a big step. To get that small possible issue that you explained, it just seems like a heavy step to take to accomplish that. And I'll close with this last question, if you respond. Have you discussed in your practice or with your colleagues the possible link of these immunizations to autism? That seems to be a big issue, and I don't know if the science is there for that one way or the other, but it just seems to me a hesitation that parents truly have this fear, right or wrong. They truly have this belief that happens. And that's a heavy step, like say, for the government to come in and say, you must do this in your head and heart, knowing this might happen.
So, Mr. Nastandi, I want Dr. Pan to respond to that. Again, members, just a time check. We have Mr. Silva now in the queue. We've gone over an hour and 45 minutes on this bill. I don't want to cut off inquiry, but I do want to make sure a lot of information has been presented. I do want Dr. Pan to respond to your question. I think just to clarify, this bill does not mandate somebody receive immunization. It requires the counseling. So people that choose to refuse immunization as parents for their children still have that right. Dr. Pan.
Yes, and I think that the importance is, again, to protect the community. And since I have an expert on vaccine safety right next to me, I'll let him respond to your question regarding that issue.
Yeah, the question of MMR causing autism was raised by a now disgraced British physician years ago. That study has since been retracted, and since then there's been 10 studies done in a variety of different countries involving millions of children. There is no scientific evidence that MMR vaccine or that other vaccines cause autism.
Just take one quick second. It just seems as if, though, there is a tremendous, I don't know, word growth in outbreak or whatever of autism.
Mr. Nastandi,
I know people myself. I appreciate that.
We're not discussing autism is
I appreciate
not
that.
part
I just
of.
wanted him to say. I would like to hear an explanation to why then autism is so prevalent as opposed to previously.
Well, that's a little bit off the topic of the bill. I think there's a lot of very active research going on. There was recently a paper looking at correlation between obesity and autism, and we're not, we have to see where that goes. There's been a lot. So there's a lot of people working on it. I, as someone who takes care of children with autism, very much want to be sure we can identify the true causes of autism, because we need to get a cure. We need to be sure people get treatment. We need to try to work to prevent autism.
I don't know how.
But people have looked at the immunization issue. There's an Institute of Medicine report, actually a couple of reports that have looked at this issue because we take it seriously. When that initial study came out, the medical community, the research community took it very seriously, looked at it very hard. There were 12 people in the initial study. They've looked at millions of children since and cannot been able to find an association between that. So, but again, this bill is not about that issue. This bill is about educating parents about the risks and benefits of immunizations, and particularly regards to their impact on the school and the community. Thank you.
Thank you, Mr. Nastandi. Mr. Silva.